The National Cabinet met this afternoon from 2 till 3. It was an important opportunity to come together as we are meeting every week, particularly during the course of these current events, both here in New South Wales and of course more recently in Victoria. But also today, I note that we have had a record day of vaccinations. Some 175,000 vaccine doses were administered yesterday. That is a new record, and it means in the space of just 3 days, 500,000 doses of the vaccine have been administered across the country. That means that already this month there have been just shy of 2 million vaccines. Just shy of 2 million vaccines already in the month of July. And each month, we are seeing the rate of vaccinations increase as we move towards our goal of ensuring that by the end of the year that we can have everyone who's seeking to have a vaccination is able to do that. It was important today to get an update on the 4-step plan that I announced around a month ago, working together with the states and territories. We are on track to get the advice back from the secretaries and directors general of all the premiers and Prime Minister's department across the country. That pulls in the Doherty Institute advice that will inform each of those steps of the plan, the vaccination rates that sit against each of those steps of those plans, and being able to get an understanding of how we're tracking against those. So I want to assure people that the path out of this and the 4-step plan that National Cabinet agreed some weeks ago is very much on our agenda, despite the challenges we're currently facing in New South Wales and Victoria, and the work continues to chart that way out and the vaccination rates we will need to achieve over the course of the rest of this year and the next year. In addition, it was an opportunity to review the status of the situation in New South Wales in Victoria. Those numbers and those issues I think are well known from both Premiers' press conferences earlier today, so I won't repeat those. But I do note that both Premiers have made it clear, and this is the focus of National Cabinet, that the cases, the target here is to reduce as far as possible to zero the cases that are infectious in the community. This is the challenge, both in New South Wales and Victoria, that we reduce those cases that are out there and infectious in the community. We've seen that rising, and we need to see those come down, and so encouraging people to stay home, to get tested and to get vaccinated are the core messages behind that. It was also very pleasing to hear from the New South Wales Premier today the extraordinary improvement that we've seen in compliance in South-West Sydney. And I want to thank all of those out in South-West Sydney. Can I particularly thank the multicultural community leaders in South-Western Sydney. You've done a sterling job working with your communities, religious and faith leaders and so many others. The compliance in South-Western Sydney has really turned around. So thank you to all those in South-Western Sydney, and let's keep doing it to ensure that the lockdown can be only as long as it has to be, and hopefully as short as possible. And to all of those in Victoria, of course going into the lockdown now, and I'll come back to this in just a moment, those economic supports are being provided, as the Treasurer said earlier today, and we released by statement late last night. On vaccines, it was a good opportunity for the Premiers and Chief Ministers to talk about what's working. The initiatives, whether it's down in Tasmania, with being at shopping centres, which are enabling people to ask questions and make bookings. In particular, we noted that those states that have been taking on additional AstraZeneca vaccines and putting them in to their state-based clinics are achieving higher rates of vaccination. And so the decisions to put more AstraZeneca into those clinics is proving very effective in lifting those vaccination rates, and we've especially seen that outcome in Victoria. And so we would encourage states and territories to continue to do that. I'd also note the progress that has been made on aged care workers, and appreciate the cooperation from the states and territories, and also working with aged care providers on that program, and General Fruin gave an update on those issues. We will be seeking over the weeks ahead to bring more pharmacists into the metropolitan program in a limited way at first. Currently, pharmacists are working with us to supplement GPs in rural and regional areas where there aren't sufficient numbers of GPs to support getting those vaccinations to those communities. Already, pharmacists are being used in places like southwestern Sydney, where there is that demand for greater points of presence. We will see pharmacists play an increasing role in the months ahead as the supply increases. There is no point having more points of presence with the static amounts of supply. That just increases the logistical difficulty. So as the supply increases, we can have more pharmacists come online, we can have more points of presence out there in the community. The other thing we discussed was how we might each, both at the Commonwealth level and at the state level, work to increase our vaccination rates on the weekends. Had a record day, 175,000, but on the weekends that drops right down. Obviously, you don't have as many GPs, offices and clinics open on the weekend. The state clinics are open in many places, but both the states and the Commonwealth are going to be looking at ways in which we can increase the rate of availability and points of presence for people to get their vaccines on the weekend.